PEGPH20 is a novel drug. It's actually a recombinant enzyme called hyaluronidase, and it's pegylated to increase its half-life. And its target is a major component of the extracellular matrix that's present in pancreatic cancers called hyaluronic acid, or hyaluron. And the idea is that the hyaluronic acid that is present in high quantities in many pancreatic tumors increases the interstitial fluid pressure in these tumors. And as a result of that, it causes the blood vessels within the tumor microenvironment to collapse. It decreases the diffusion of drugs from vessels into the surrounding space, so it decreases the ability of drugs to get into tumors. And so by breaking up this hyaluronic acid, this drug has been shown to improve drug delivery, which hopefully results in improved anti-tumor efficacy in patients with pancreatic cancer. PEGPH20, when combined with chemotherapy, may enhance the delivery of chemotherapy, allowing it to penetrate and affect its anti-tumor activity in tumor sites more effectively. This is by decreasing the interstitial fluid pressure, by allowing the blood vessels that normally are somewhat collapsed to expand and improve the permeability and the diffusion of concurrently administered chemotherapy drugs into the sites of tumor. PEGPH20 was studied in a fairly large randomized phase 2 study. This study focused on patients with metastatic pancreatic cancer who were previously untreated, and patients were randomized to receive either gemcitabine plus nab-paclitaxel, which is a standard of care option for patients with metastatic pancreatic cancer, so either chemotherapy by itself or chemotherapy in combination with PEGPH20. And this was a fairly large study, as noted, of about 260 patients or so, and the results we've seen so far look quite promising. And by that I mean that if you take the entire study population, the addition of PEGPH20 to chemotherapy didn't lead to an appreciable improvement in progression-free survival or response rate. But when you took the proportion of patients who had elevated levels of hyaluronic acid measured in their tumors, which was approximately 30–35% of this study population, then you saw a significant improvement in progression-free survival with the addition of the PEGPH20 to chemotherapy. You saw higher response rates. And now these numbers are still fairly small and require further validation, but it offers a promising proof of principle that PEGPH20 may potentially be beneficial when added to chemotherapy, specifically in patients whose tumors express high levels of hyaluronic acid. So the assays to measure hyaluronic acid in patients' tumors is basically, it's an immunohistochemical assay. So it's an antibody that's been further developed and is now being used in the current ongoing phase 3 study. It requires actual tumor tissues, not just fine needle aspirate, not just some cytology sample, but an actual tissue block where you can measure the content of hyaluronic acid. And right now the threshold for defining positivity of HA using this tool is 50% or greater staining in the extracellular matrix. So irrespective of the high versus low levels of HA, the study actually found in the first stage that there was a higher than expected incidence of thromboembolic events, so blood clots, DVTs, pulmonary emboli. And as a result, the study was temporarily halted so that the study could be redesigned, that all patients would be prophylaxed with low molecular weight heparin. And after that point, the incidence of thromboembolic events actually decreased back to baseline, or what we would expect in this patient population. The other common side effects that appear to be associated with PEGPH20 include development of edema, and then these muscle cramps or muscle pain, myalgias. So patients typically are pre-medicated with steroids before they get treated. There seems to be perhaps a little higher rate of neutropenia, so low blood counts for patients receiving chemotherapy with PEGPH20.